Post-traumatic stress disorder, PTSD, is a complex mental health condition that can develop in individuals who have experienced or witnessed a traumatic event. In this exploration, we delve into the depths of PTSD, shedding light on its symptoms, causes, diagnostic criteria, and treatment options. Understanding PTSD, the lingering impact of trauma. PTSD arises in response to exposure to a traumatic event that poses a threat to one's physical integrity or safety. Such events may include natural disasters, combat experiences, physical or sexual assault, accidents, or witnessing violence. While it's normal to experience distress following trauma, individuals with PTSD continue to struggle with symptoms long after the event has passed, significantly impairing their quality of life. Exploring the spectrum of symptoms, unveiling the trauma response. The hallmark symptoms of PTSD encompass four main clusters. Intrusive memories. Individuals may experience distressing flashbacks, nightmares, or intrusive thoughts related to the traumatic event, causing them to relive the experience repeatedly. Avoidance. Efforts to avoid reminders of the trauma, including places, people, activities, or thoughts associated with the event, are common among individuals with PTSD. Negative changes in thinking and mood. Persistent negative beliefs about oneself, others, or the world, as well as feelings of detachment, numbness, or inability to experience positive emotions, characterize this cluster of symptoms. Arousal and reactivity, hypervigilance, exaggerated startle response, difficulty concentrating, irritability, and reckless or self-destructive behavior may manifest as heightened arousal in individuals with PTSD. Navigating the diagnostic landscape, identifying PTSD. Diagnosing PTSD involves a thorough assessment of symptoms and functional impairment, guided by criteria outlined in diagnostic manuals such as the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. To warrant a diagnosis, individuals must exhibit symptoms persisting for at least 1 month and causing significant distress or impairment in social, occupational, or other important areas of functioning. Untangling the roots, exploring the causes. The development of PTSD is influenced by a complex interplay of genetic, neurobiological, psychological, and environmental factors. While not everyone exposed to trauma develops PTSD, predisposing factors such as prior trauma, childhood adversity, genetic vulnerability, and lack of social support may increase the risk. Pursuing paths to healing, treatment, and support. Fortunately, effective treatments and interventions are available to help individuals with PTSD reclaim their lives and navigate the path to recovery. These may include psychotherapy, evidence-based therapies such as cognitive behavioral therapy, CBT, prolonged exposure therapy, and eye movement desensitization and reprocessing, EMDR, are effective in reducing PTSD symptoms and improving coping skills. Medication. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, may be prescribed to alleviate symptoms of depression, anxiety, and intrusive thoughts associated with PTSD. Supportive services, peer support groups, trauma-informed care, and community resources can provide valuable support and validation to individuals with PTSD, fostering a sense of connection and understanding. Empowering through understanding, breaking the stigma, and fostering awareness. By fostering empathy, awareness, and understanding, we can dismantle the stigma surrounding PTSD and create a supportive environment for those affected by trauma. Through education, advocacy, and access to evidence-based treatments, we can empower individuals with PTSD to embark on a journey of healing, resilience, and reclaiming their lives. In essence, post-traumatic stress disorder, PTSD, represents a profound and often debilitating response to trauma, shaping the experiences and trajectories of those affected by its complexities. By shedding light on its intricacies and offering support and validation, we can foster a culture of acceptance and empowerment for individuals navigating the aftermath of trauma.